Hello, I am Dr. Poornima, one of the consultants in Aster RV Hospital, JP Nagar. Today I am going to talk about the least spoken topics about fever in pregnancy. Do you all know what is fever in pregnancy? Any fever which comes outside of pregnancy, if the same things happens during pregnancy, it's just known as fever in pregnancy. It is not normal and it should be worked up. What is fever? Sometimes most of the pregnant women feel hot. What is this hot? The body temperature generally is normal 98.6. So if it is around 98.8 or 99, it is okay. But anything above that is considered abnormal and the woman is said to be having fever and it should not be ignored. What are the causes of fever? It could be viral, it could be bacterial, it could be protozoal or parasitic. So we should rule out what are the causes of the fever. The most common is viral. It could be a common cold. These days we have the COVID which is going on rampant. So that should also be ruled out. Or bacterial like any typhoid, cholera or anything could be the cause of fever. And it could be other as protozoal or parasitic like dengue can be there or malaria in pregnancy can happen. All this should be ruled out. Now coming to the investigations if there is fever in pregnancy. If there is fever in pregnancy, when you seek your healthcare provider as to what the cause of fever is, the general test which is done is a complete blood count, which is generally done as a baseline during early months of pregnancy. So on top of that, when we see there is a variation, there's an increase in the white cell count, then we rule out yes, there is infection and we treat for the same, if necessary with a safe antibiotic course. Then we do a simple urine test as well if the woman is otherwise having symptoms. Sometimes fever can present without any other warning as well. They might not have any additional symptoms, either the urinary symptoms or the respiratory symptoms like cough or shortness of breath or something like that. Sometimes fever can be associated with pain in the tummy, like sudden uterine cramps or leaking of waters later in pregnancy. If fever occurs in the early of pregnancy, in the first 3 months, then sometimes it is an all or none phenomenon. It can affect the pregnancy, but the risk is very, very small. Studies have shown they have children having autism and attention deficit hyperactive disorder in such pregnancies. So, but the absolute risk is very, very low. So what are the warning symptoms that you should come to your healthcare provider? One is fever along with chest pain or shortness of breath or painful uterine cramps or leaking of waters, or if there is an unexplained fever going on for more than 2 days. Having home remedies, having paracetamol or what we say Dolo 650, which is commonly, or Calpol, you can take it. But what is the dose? The recommended dose in pregnancy, it is according to the weight. It is not the normal adult weight, and we give it as and when you want. We measure the temperature and you use it as and when required. So please do visit your healthcare provider if you are suffering from fever for more than 48 hours and it is not coming down. Simple remedies like dampen moist cloth and sponge bath or cool in a cool room, wearing light clothes and light bath is okay. Otherwise, other medications, over the counter medications are not advised in pregnancy. Thank you.